Ear infections in children are one of the most common ailments a new parent faces. The American Academy of Pediatrics has some new guidelines on how to treat them. It's estimated that half of all children under age 1 will experience an ear infection. In fact, 75% of kids can expect to battle one before age 3.
There's not much that you can do about an ear infection at home. Some of them are viral, which means that they will go away on their own, but a lot of them are bacterial, which means that they need medication.
So, the American Academy of Pediatrics is putting out new guidelines to follow, recommending treatment options based on the child's age and severity of the symptoms. They include antibiotics and pain relievers or watchful waiting. Under the new guidelines, the goal is to not always prescribe an antibiotic for every ear infection. But Dr. Raisman says if your child is experiencing any symptoms, it's better to get them into your pediatrician's office sooner rather than later.
Sometimes they'll stick their fingers in their ear, sometimes they'll rub their ear on the carpet if they're young, sometimes they'll actually tell you, or they'll start tugging on their ears. So sometimes that's just stuffiness from a cold, but sometimes an ear infection. And the only way for us to tell is to actually look.
Dr. Raisman says if a child has multiple ear infections over the course of a year, they may need tubes to prevent fluid buildup and decrease the pain. It's best to talk to your doctor to determine the best course of action. With Everyday Health, I'm Taryn Winterbrill.